Dementia, yeah, as you rightly mentioned, dementia happens to be a modern pandemic, and we see the healthcare facilities throughout the world are increasing. And with that aspect, what we see, there is increase in the survival. I mean to say, people live longer, and with people living longer, what happens? There are issues which are coming up, and one of the issues is this dementia. That means with increasing age, more and more patients, people land into dementia. The geriatric age group has got a particular subset of problems of their own, and as far as the elderly population is concerned, their disease pattern is different from the youngsters, from the infants, from the newborns. Uh, Entirely, I mean to say, they have got some other issues, and as far as the dementia is concerned, we are well aware that it is becoming a big problem as far as our social circle is concerned, as far as its impact on the individual himself is concerned, as far as the impact on the society is concerned, as far as the impact on the family is concerned. And these are real issues, hard issues, especially with people, especially with I mean, say, children who just look after their parents. This dementia happens to be causing a havoc as far as all the problems faced by the elderly are concerned. Now, what happens in this subset is that we have got issues of multiple in multiple areas, in multiple aspects, multiple dimensions. And what is the problem with dementia is that usually these elderly people, they have got issues in their memory, they forget a lot, their thinking is gone to a different extent, I mean to say, thinking, judgment, orientation, language, that they call there are so many issues which these people face. And what is important about I mean to say, these things like forgetfulness, they tend to forget things easily, where they place their specs, or where they place the keys, or about their food habits, about their parts of judgment in talking with them. They lose the insight about time, I would say space. They some people, it depends upon lot about the intensity and the severity of dementia they have. In early phases, you do not recognize much of things, but issue is that in the late phases, once the dementia takes its toll to a severe degree, people have got issues of real nature, and we see that these issues are very, very difficult to handle by the patient themselves, and it becomes a big source of problem with the family. And what happens? There is memory loss. The patients who have dementia, they are confused a lot, and that is affecting their day-to-day activities. I mean to say, in addition to their other problems, maybe there might be complicating factors like, I mean to say, they have got urinary problems, they have got defecation problems, they have got problems in the intake of their food, they have got their about their personal hygiene, and these are areas which are, I mean to say, very important. These cannot be ignored on the day-to-day basis. We come across these issues, and they have got, I mean to say, a severe impact on the individual themselves, because these people find difficulty in communication, these people find difficulty in their behavior, these people get their psychological problems. Some of them are having associated diseases like diabetes, like hypertension, like different psychological ailments other than dementia, and they compound the total individual's I mean to say, behavior. So as far as dementia is concerned, it is, I mean to say, a modern pandemic, and it has got, I would say, a long-lasting effect on the society, on the financial aspect of the individual himself, because at this point of time, they are almost retired from their services. They are not an active population, active earning population, and the family, how far the family can support them, and then especially in underdeveloped worlds, we don't have a backup system, elderly homes, proper orientation who can take care of these people. So that is an issue as far as dementia is concerned, and its implications on the society are concerned. Now, Basically, I will not go much into what are the various types of dementia because I mean, this is for the general public, and you know that the most common cause of dementia is the Alzheimer's dementia, and Alzheimer's dementia is, I would say, it has got its own pathology, it has got its own implications as far as medicine and psychiatry are concerned. So I will not go much into the depth. What is Alzheimer's dementia? What is Lewy bodies dementia? What is multi-infarct dementia? Or what are the various other types of vascular dementia? But one thing I would just like, there is one important category of dementia, and that is the presenile dementia. That means usually dementia used to be of the disease of the older population, geriatric population, but now the spillover into the younger age group, which is important as a presenile dementia. And we are very, very much concerned about that type of dementia because we see many cases, I mean, say younger age group, which is getting affected by the dementia. There are so many things which can be precipitating to the dementia, the genetic makeup of the individual, the genetic propensity, the genetic tendency, and the lifestyle risks. But the thing is that as far as dementia is concerned, Alzheimer's happens to be the most common type of dementia. Now, these days, we are not having issues with diagnosing dementia, the clinical history, I mean, say, we have got those, I mean, say, uh, once we take the history of the patient, we sit with the patient for a long period of time. We just see the areas of his orientation, judgment, insight. We make various tests. There are so many tests to diagnose, and we just ask the relations, the attendance of the patient, and they give a clue about his problems and the patient himself on examination, where I would say it's not a hi-fi thing to just diagnose dementia. But important thing is that in addition to the in neurological tests like CT, MRI, PET, which can show atrophy, cerebral atrophy, I would say the loss of the depth of the sulci and gyri. These are some things which are from a medical viewpoint, but I'm not here concerned about that point much. But important is that we have got with the increase in the, I mean, say, advances in the medical sciences, diagnosing dementia is not an issue. The brain imaging, the MRI, CT scans can just detect the structural changes and rule out other causes which might mimic or simulate dementia. And what is important is the early diagnosis and treatment. We have to start the treatment. We have to start the treatment at the earliest. But one important thing about dementia is that, though, I mean, say, see, if there is anything which is progressing, it's the medical sciences. The medical sciences are progressing beyond a limit. I mean, say the recent advances. There are so many drugs which we give to these patients. I see so many patients taking donepezil, rivastigmine, and galantamine, and memantamine, and these are what's the issue? Issue is that from a personal, you talk to any, these are not the drugs which give an immediate relief to the patient. So drugs, pharmacology, it's fine, but the important thing in dementia is that you have to take care of the patient. And who takes care of the patient? That is very, very important. Busy lifestyle, I mean to say, everybody almost in the working class, strict working hours. Are there any people to take care of the old aged parents? I mean to say the children. That is a big issue. Nursing care, I would say they are offered, but how far the nursing care will be effective, it depends. It depends upon. Now, what's important? Important is that there are so many challenges because what I told you, these drugs which are there for the dementia, they do not cure the dementia. The cure in the dementia is not perfect. I would say that, yeah, they can afford in some cases the response to the drugs. That is considerably variable. And importance is that if any neurologist, any psychiatrist tells you that these drugs are very, very effective, I hold a negative view about that. I have seen it from a personal experience. I have worked in some elderly homes in UK, and there I have seen that the response is, I mean, say, very less. We can have tall claims about the drugs. I mentioned these drugs, galantamine, memantine, and but in addition to that, they need to have a very important component, and that component is the care, the need for care as far as the, because see, hygiene, you have to have a patient who is dementia. Now imagine an old patient who is having dementia, and he's not able to take care of his hygiene, of brushing his teeth, of his nails, of taking the food properly. He or she can land into aspiration pneumonia. um, so I mean to say that daily hygiene, problems with urination, problems with defecation. Some patients with dementia have already a concurrent stroke. They have got Parkinsonism, Parkinson's plus syndrome, Shire-Raggers. I can go a whole list of things which I have seen in my life with patients with dementia, not able to recognize themselves, not able to recognize their children, not able to recognize their pets, especially outside, not able to, I mean, say, remember the things of daily routine, not able to remember whether they have had breakfast, lunch, dinner, or whatsoever, not able to remember the important documents they are having, not able to remember where they place the keys, not able to remember where the specs lie, not able to remember whether, I would say, uh, any mode of life. So that is a bit of an issue as far as these patients with dementia have. And what is important is that we need to have community programs in a country like ours, where we do not have established, I mean to say, elderly care homes in a manner they should be, where there should be a special nurse to trim the nails, there should be a special nurse to brush the teeth, there should be a special nurse to take the elderly one to the washroom, to I mean to say, to bath the patient, to I mean to say, uh, have a proper defecation protocol, to have a proper urination protocol, to feed the elderly at appropriate times. So we need to strengthen the communities. I mean, say, we have to develop a system wherein, because of the systems, we have to have these community programs and support groups. It can be at a government level, it can be at an individual level, it can be at a community level. So basically, we have seen that in the subcontinent, we do not have a strong community program, and this is where the focus should be. Now, care and counseling. How do you do the care? They're specially trained people. It is not that, I mean, say that it is not like that you have got the same nurse who just does physiotherapy, who just injects, who just takes the blood samples, the same people. No, you have to have specific people to take care of the elderly in a very, I would say, special concentration for those group of people, taking care, special nursing care for the elderly. That is very, very important. And because these people have got so many issues, then what is important is to educate not only the patient, to educate the attendant, to educate the children that, yeah, your father, your mother who is very elderly, who's very aged, they are to be counseled that the patient can land into more complications, because there are sometimes problems with their muscle mass, problems with their tone, problems in communicating. And once you are there as a family, you are the first recipients of this abnormal behavior. And that's why counseling of the family is very, very important, especially the children, and those in absence of the children, those who are taking care of the people. So that is very important. So we have to strengthen the grassroots levels, I mean, of taking. So what are the summary and the key takeaways? Dementia is not, I mean to say, something which is invincible. We have to overcome it, because aging, you never know about the life. You might be yourself affected at some point of time in your life in future by this very process. It is not within your control, and we see that the instance, the prevalence of dementia is increasing day by day all over the world, the developed world, the underdeveloped world, the developing world, because we are having improved in the healthcare facilities. But the improve in the healthcare facilities increases life span. And what does this increased lifespan do? It gives you a life sometimes, unfortunately to say, that which is not productive, which in which you get so many complications. The only thing is prevention, and if it has already set in, then you have to take proper appropriate measures for that. So this is in a nutshell what I wanted to convey, and I hope that this helps a bit. Thanks a lot.